daughter of Captain Sir Tom Moore here on Hospital Radio Bedford on the 1st of May last year. Amazing human being he was. I've got Dr. Seshini Mudia here for the COVID update. But before we do the COVID update, it's important that we talk about this very important personality who's just left us. He's left us, but his legacy has not left us. His legacy is still here with us in the United Kingdom and, of course, everywhere in the world. What an amazing human being. And Dr. Seshini, as we all know, or she said it a few times, and I have said it this morning, has got a very special relationship with this family because Dr. Seshini's daughter is very good friends with Sir Tom's granddaughter. So it's really hit hard on her. Well, yesterday I was speaking to her and she was quite emotional because, of course, she knows the family very well. Good morning, Dr. Seshini. I don't mean to make you emotional again this morning, but welcome to the show. And before we do the COVID, it's important that we talk a bit about Sir Tom. What was your relationship with them? I mean, we know that you're very good friends, but how close were you to the family?
Yes, so quite close, Opoku, as you've said, you've spoken to Hannah, so you know her as well. But in terms of relationships, so before Sir Tom Moore became quite famous, we had birthday parties together. So Sir Tom's granddaughter would come and go for birthday parties with Sitara. They had at Nando's a year ago. And also we would be on the golf course together. So myself, Hannah, Colin Ingram Moore, which is the son-in-law, as well as Georgia, would be on the golf course together in Bedford. So it was a very close relationship because obviously Sitara is one of her best friends is Georgia, and they were in the same class. So we sort of knew the family pre Sir Tom Moore getting famous. Knowing him and knowing about him, we got to know about him obviously through Hannah. Myself and her, we used to go out with the ladies and mums of Bedford school. So we used to go out, we used to hang out and talk about our families. So we got really close, sharing Christmas photos. And I remember first seeing Sir Tom Moore on a Christmas photo, which was about 2 years ago. And that's when I realized, what an important part he was in terms of Hannah Moore's, Ingram Moore's life, as well as Georgia's, because I responded immediately saying, such a lovely picture, not realizing that this individual would play such an important role. There's so many people that come into your life and into this world, and not everyone will leave a mark and legacy as Sir Tom Moore has. And he definitely has left that imprint, being such an amazing human being, a hero, and someone who's set the bar so high in terms of inspiring people through such a difficult time. And as Hannah described him, he was a beacon of hope during the fog. And he was described by her as an inspiration and an incredible man. And that's exactly what we know of him. So it's really hit close to home. Losing, when we lost my mom in May last year, Hannah, that was around the time Sir Tom Moore was becoming quite famous because of the fundraising. He raised 33 million for the NHS, which we are so grateful for. So around that time, she supported my family. She also contributed to the Just Giving, the fundraising page that I was having for my mom's case. And so it was a very close relationship, as you can see. So even now, when it started, the news came out on the 31st, immediately I sent a message. We spoke about it, and she responded back. So it's really obviously hit close to home. It's very sad to know that he's passed away, because we know how close as a family they were to him. But not just for them, but for the whole world that's mourning. I do feel that there's so many people he's touched the lives of, and I don't think these few minutes is going to do justice. I did my Happy Doctor's Kitchen show last night, and I dedicated it to him because I was feeling really, really sad, as you know. Sitara as well was feeling it.
Because I could tell when I spoke to you in the afternoon, and when we both realized or knew, we
Yeah.
got the news that he had passed, and then we spoke on the phone. I could tell that you were very emotional, so
Yes.
that's why I didn't want to talk too much, because I didn't want to I didn't want
Yes.
to upset you some more. But hey,
No, I understand. We've all had to go through these difficulties. But like I said, it's not just us mourning, it's the whole world. I mean, you as well have spoken to Hannah, you interviewed her. So, you know, the family as well. And, you know, so it's sad for a lot of people. But even people that didn't know him, this is the, you know, like Nelson Mandela, Martin Luther King, you know, all these people, Mother Teresa, that come into your life or that you know about, that you leaves an imprint in your heart that, you know, you'll never be able to forget them. He's been immortalized. He's been knighted by the Queen, Her Majesty the Queen, last year, and he's been immortalized as a hero. He's definitely done something which no one else in the world has been able to achieve. And
absolutely nobody has done that.
yes, but I do believe, you know, my message to Hannah yesterday was, immediately when I saw the news, I sent it to you and I messaged them, and I said, and I put it on social media just to say that I know he will always be in their hearts. He's left such an imprint, and I know how much they loved and cared for him. And our prayers with them, from myself, Ferdy, Shreya, Arin, and Sitara, and the rest of, obviously, yourself and the Hospital Radio Bedford, just to offer our prayers and condolences to the family, and our prayers that they will get through it. And I did say that, you know, that I know that they've gained an angel watching over them, and he's always going to be part of their lives, even though he's left us on this physical plane on earth.
Yeah. Well, I was speaking to the two things I want to talk about now.
Yeah.
I was speaking to Ian
Yes.
Griffiths yesterday on the phone,
Yeah.
and we were talking about Sir Tom, and was saying what an incredible human being he was. And I said to Ian, for 99 years,
Yes.
he wasn't really known. He was such a nice person, humble, hardworking.
Yeah.
Nobody knew him around the world except probably his family and his army corps.
Yeah.
And sorry about that.
Yeah.
And the people close to him and around him. And then suddenly, within 24 days, I'll say, from when he started doing his laps in his garden, he just become a national and an international icon for his selflessness and the fact that he wanted to do something, give back to the health service for looking after his wife when his wife was in hospital, amazingly. And when he himself was in hospital, he was really looked after. And you know, in that situation, the pandemic, in the lockdown, and he's thinking to himself, look, you know what? Let me do the little I can to give the little I can. They were actually aiming at £1,000. The little I can to the NHS, give back. You know, the lessons that I learned from this is, first of all, that it's never too late to start something. For 99 years, you know, and then within a few days, he'd raised about £33 million for the NHS. And then the second lesson I learned is that we always must give back to the community and to the society. And selflessness, humility is the key. And I was really touched, and I'm still really touched by him. Yeah. And the other thing I want to talk about is the closeness of his family. Yeah. I mean, you're talking to Hannah, and you can just feel the love and the closeness and the how will I say, the protective nature of the family for each other. And I think it is fantastic from Hospital Radio Bedford and from this show, HRB Breakfast, from myself and from you. We wish them all the best. Yeah. And we say, just keep cracking on, because that's what Sir Tom would do.
Yes.
Amazing.
No, I love the 2 points you
Anyway,
raised, and just in it, just to follow up on that, the first thing was, he actually in his statement, and I wrote an article for Global Indian Stories 2 days ago because of the news that broke out, and I knew this was really important to capture these moments of Sir Tom's last few days, which obviously we didn't know. We still hoped. I really hoped and prayed that we would have had a positive outcome, and I would like to say that to Hannah that there were so many prayers out there, so many people that poured tributes, including Boris Johnson, Neil Starmer, and Michael Ball, and all over the world, people were sending wishes, and we really hoped that this would have turned out to be a more positive outcome. And we are truly sorry. Obviously, it did not work out. But just going on the point of what you said, he gave back. When I researched for the article, he said he wanted to give back to the nurses because of the care that they had given him and his wife, which is so amazing. And that's what he wanted to do. And I know when Hannah she sent the fundraising page out in the WhatsApp group. So this is how close we were. So she sent it on the mums group and to me personally. And immediately I was the only one out of like 100 on that group that responded. And I said, definitely, I'm going to give back. I'm going to, honor this, and I'm going to contribute. And then obviously when he became famous, when the numbers started increasing in terms of him becoming, getting millions for it, then everyone else responded. But I was like the only person. I can show you the WhatsApp group. But it's just about the fact that how close they are. That's the second point, is that they're really a close family. We've had those close moments with them. And when you meet people like this, you realize what type of people they are, seeing them on the golf course, going out with them for dinners, with Hannah on her own, I've been out with Colin and Hannah for fundraising for the hospice together. And also, with Sitara and Georgia having lots of play dates and parties together. So, even when they came to fetch Georgia, when they would come fetch Georgia, it would always be all of them together. They all came. Benji came with Hannah and with Colin. And even if Tom Moore wasn't there, we knew about him because Hannah would talk about him. So even though I hadn't met him initially, we would know that he was such a high functioning. He was actually so high functioning. He was exercising regularly. He was also cooking. He used to cook meals. So Hannah told me the one day that like very early on in our relationship, in our friendship, she said that he used to prepare meals. And I said, how old is your dad? And then she said he's 99. So I was like, so 98 at that time. So I said, wow, I was so impressed. So this is it. He was really part of the family, in terms of relationships, they social events, they, activities, and in terms of the lives of the grandkids, because that's how close they were. And I know Georgia is going to take it very hard. She is taking it very hard, as well as Benji. As well as Hannah and her sister and the rest of the family. So yeah, it's really, really a loss to the community.
I just thank God that he died with his family around him. Because obviously, from what you're telling me and from what I've heard from Hannah herself, very close family. So it's just assuring that he died happy. With the people he loved right close by his side. Unfortunately, he died of COVID-19, and that brings us to our next. It brings us to the COVID update.
Can I just say thank you to the hospital staff, and to Hospital Radio Bedford for doing the 12-hour shift and then the 24-hour dedication. I think that meant so much, even though we didn't get the positive outcome we all had in our hearts and our prayers. That all would have gone to him, and he will know, wherever he is, he's looking down, and he knows what sincerity it was done with. The intention was to get a positive outcome. But even though he didn't make it, he's now left us, but he will know what we've done, and that it was done with so much of love and gratitude. And, so grateful to Hospital Radio Bedford, to the volunteer staff, to you and the chairperson, as well as also to the hospital staff who have worked brilliantly to keep his last days, as comfortable as possible, to have his family around him. When I saw the article about the family, then I realized that this was obviously there was something else going on. So, and we spoke about it. So, thank you so much to Hospital Radio Bedford and to Bedford Hospital staff for doing such a brilliant job.
Okay, now let's go. Let's do the COVID update here.
Yes.
And this article I just saw this morning about the AstraZeneca
yes
vaccine. Oh, that's another one. There's another one that's just popped up. It's the results that show that the Oxford AstraZeneca vaccine may reduce the spread of coronavirus has been hailed as absolutely superb by the health secretary.
Yes.
Now, what they're trying to say is that the AstraZeneca, the Oxford AstraZeneca vaccine may reduce the spread of the coronavirus. So in effect, it doesn't only
prevent.
When you take the jab, it doesn't only help you, but it helps others.
Yes.
It helps not spread the virus.
That's fantastic news. So from BBC News, yes, I mean, that's amazing that obviously in addition to being effective against preventing COVID-19 infection, this AstraZeneca Oxford vaccine is now able to reduce the spread, which is good news because they're saying that it was 76% effective during the first 3 months when it was first given. The impact on transmission is critical, as you've pointed out, that when you get the vaccine, then obviously you will actually prevent the spread of the virus as well, which is what we are all aiming for. That is why we are in lockdown, is to reduce the transmission, reduce the rate of infection, and to reduce the mortality and the deaths, which we are still seeing with the virus. So that's really important news, Opoku. That has come up, and there was a few others in terms of the pandemic about the variants. So there seems to be a lot of concerns with regards to the variants. I don't know what your take on that, but it's not just the UK and South African variant. There's some other variants, and UK has become very concerned about the other variants. I think it was a EK something. I need to look back again at it, but it was a new variant which has come up, which we can probably talk about tomorrow when we have more time.
Tomorrow, because there won't be too much. There won't be a lot of time today to talk about. But I haven't even researched on that, so
I was reading on it.
To go back and
I was reading on it because there's a lot of information and it's a lot of concern. As you pointed out the other day, there's blitz testing in terms of the variant, so that they will be knocking on people's doors and testing. That started out in Surrey and started all over the world, all of the UK. I mean, people are getting scared about the variant because the variant seems to have transmitted all over the world. So it's not just in the UK, it's South Africa and globally. So there is concerns with that. It is a concern. I just wanted to say one of the headlines which actually caught my eyes today was a Sky News saying that more than 10 million doses of the vaccines have been administered in the UK as deaths rise by 1,449, with a further 16,840 cases.
Wow. So what's the well, I think we should just do the numbers now, and then tomorrow we will have an in-depth COVID update, because
I think that's good. I know we're running out of time today.
It's more, and it's more for say at home,
Yes.
But of course we needed our coronavirus update. So if we do the numbers, and then you can tell us what happened in the last 24 hours in the United Kingdom, because I'm quite curious.
Yeah. Okay, so thank you, Opoku. And so we have globally, I've just refreshed my page, so hopefully it's up-to-date information, but you can check that as well. So as of today, the 3rd of Feb 2021, we have 104,400,796 positive cases. Deaths is 2,262,854 deaths globally. Total recovered is 76 million, sorry, 272,464 in terms of those that have recovered. The top 5 countries, USA number 1, and USA has increased now from 26 million to 27 million. And 27
million.
Yeah, 27 million and 27,347 with 457,856 positive cases and deaths. So they're nearing 500,000 deaths. India is 10,778,206 positive cases with 154,635 deaths. Brazil number 3 with 9,286,256 positive cases with 226,383 deaths. Russia number 4 with 3,884,730 positive cases with 74,158, and UK 3,852,623 positive cases with 108,013 deaths. South Africa number 15 with 1,458,958 cases with 44,946 deaths, and Ghana quite low down with almost got it. So I think I've gone past it. Sorry.
88. It's 88.
Yeah.
Number 88.
88, which is 67,782 positive cases with 424 deaths. And then looking at the last 24 hours.
That includes my former boss.
Yes. Oh.
Yeah.
Yes.
It's a shame he died on Monday from COVID.
Okay.
Anyway, let's crack on.
Oh, that's sad to hear. Condolences with the family. Yeah. It's really hitting very close to home. So just in terms of the 24 hours update, as I said earlier, 1,449 new deaths with 16,840 new cases. So the numbers have gone up, Opoku. And I just want to say, yesterday was like 1 year that we've been reporting on this. And this morning I was thinking, you know, imagine, look at the cases. Would we have envisaged and predicted that we would have 3,852,623 cases with over 100 deaths, Opoku. For a year ago we started.
No way.
We were not anywhere near this, and this is where we're at. You know, it's important to highlight the milestone, and it's just really it's obviously difficult, and I'm hoping that one day we can both announce that, you know, there's 0 deaths, 0 number of cases.
0 deaths,
and hopefully that day is going to come soon, now that the vaccine is on the horizon and has reached lots of different countries, including South Africa with the new getting the vaccine on Monday, and also maybe having it rolled out in the next 2 weeks. So fingers crossed, and prayers with everyone that's going through this pandemic and losing loved ones, and especially to Hannah Ingram-Moore, Benji, Georgia, Colin Ingram-Moore, and the Ingram-Moore family. Our condolences to you all for your loss.
Have you got a song that you want to play for them?
I think Never Walk Alone. I think that's the song, the Michael Ball song, or the song that if you've got a Tom Moore's one.
I played that already, unfortunately.
Okay, I didn't listen to. Sorry, I was a bit early, so I hadn't. I know you got up quite early. You were broadcasting from 4 o'clock, so I don't know how you did it.
Choose another song. Choose another song. Choose another song.
I think Mariah Carey, Hero. I think that's something that I would absolutely love, because
I played that already.
Oh no. Are you serious? I was sleeping.
It was
probably.
The first song I played this one. No,
Are you serious?
I can play it again. It's not a problem.
So I think
I'll
that
play
song.
it again. Mariah Carey, Hero.
Yeah, I think
Tom
that
was it. I
because
mean, of course, as they say in broadcasting, if the song is nice, you play it twice.
okay,
So,
because that is
I'm gonna
amazing
play
that
from you and your family to the more family. But before you go quickly, let me just bring this to mind. You know, Captain Tom started a foundation to a foundation in combating loneliness.
yes, yes, I
Okay,
did.
so I would like to say that please go to our website to www.hospitalradiobedford.org.uk or our Facebook page, Hospital Radio Bedford, and you will see the link to the what you call it, the sorry about that, the foundation. I was looking for that word. Yeah, foundation, and it's captaintom.org. You click on that link and make a donation to the foundation in combating loneliness. Not just you, Dr. Seshni, but if you're listening to me right now, please do, wherever you're listening from, anywhere in the world, in the UK, America, in Africa, in Asia, wherever you are, please donate to this worthy cause.
I mean, isn't that amazing? Yeah, isn't that amazing? Even through his death, we are still able to show gratitude and also remember him. And also he's still helping people, you know, combating mental health during COVID-19, the NHS charities that he raised 33 million, and now with captain tom.org, you know, for loneliness. So he's such an amazing individual, and that's why Mariah Carey's song Hero, I love that song. It's such beautiful words. It's amazing that we've chosen like similar songs to play, but you know, that was something I just thought would be amazing. I know you played Jerusalem yesterday for me. At some point I would love that song as well, because that would be something I'm sure it sort of embodies his type of spirit, and you know, his get up and go attitude, his fight against the challenges of COVID-19, and also the inspiration and incredible man that he was. In my article with Global Indian Stories, just to say that, you know, I quoted him. He said something on BBC News. I don't have the full thing in front of me. I should have written it out, but it was something to the effect of that, you know, we must all realize that obviously we're going through some challenging times, but we will get through it. We will not walk alone. And also,
what his phrase is, his popular phrase that's become quite popular on social media. It's like, tomorrow will be better.
Yes, tomorrow will be better, and the sun will shine.
Tomorrow will be better.
Yes, the sun will shine again, and the sky will be blue, and there will be rainbows, and that's also what he said. So I'm just hoping, like Hannah said, he was a beacon of light through the fog, and even through his death, we are able to honor him, to cherish him, to love and show gratitude for him, and to continue his legacy. So thank you so much, Opoku, for allowing me to share my personal stories of the family with you and with Hospital Radio Bedford.
And thank you for your tribute to him. I'm going to play that song, Hero. So, Captain Tom, wherever you are, looking down on us,
he is definitely
smiling. I'm sure you are.
He is.
This is coming from the Woodlea Rinsbeck family.
Thank you so much, Opoku.
Yourself, and also to the whole Moore family. Thank you very much, Dr. Seshni. I'll play that song in a minute. Thank you for coming. I'll see you tomorrow. And tomorrow we're going back to normal. We start at 7, and we're going to do an in-depth, updates of the COVID situation. Bye for now, and I'll see you tomorrow.
Thank you. God bless. Thank you everyone for joining. That was a hospital radio update. Obviously it was shorter than normal and a bit early as well. So hopefully you guys were able to tune in. Guys, do stay safe wherever you are, and lots of love from my family to yours. Again, condolences to the Ingram Moore family, to Hannah, Georgia, Benji, Colin, and the rest of the family. And our prayers with you all and everyone else that's going through losses during this COVID-19 pandemic. We've also had our fair share set of losses, and we will be observing a funeral for my uncle Nanda. So my condolences also to the Naidu family in London, and to Auntie Rani, Nameen, Nalini, and the rest of the family, the Kapoor and Naidu family, for their loss. And we are hoping to join them today, this afternoon, for the funeral. So do stay safe, guys. If you're going through any losses, get some help and speak to someone. Don't suffer alone. And just remember, your loved ones are always, always with you. And they will never leave you, because they always will leave an imprint in your heart. And lighting a candle, I find, is very helpful, and offering prayers just for their souls to rest in peace, cherishing their memories, and drawing on the support of your friends and family. So lots of love, guys. Let's spread the love and not the virus. And do join me later for some cooking, happy and healthy cooking. And obviously the rest of today we will be honoring Sir Thomas More, as well as my uncle Nanda, who was a sort of grandfather figure to my kids. So lots of love, guys. Namaste, and stay safe wherever you are in the world.